Awesome. Well, welcome everybody. Good morning, good afternoon, wherever you're joining us from today. We're really excited to have you here on this very special topic with Dr. Audrey Wells on what makes CPAP successful, the gold standard of sleep apnea. So many of you who are on the call today, I'm sure you've thought about a CPAP or have heard of a CPAP, have been scared of a CPAP, said, no, not me, never using that. So today is the day for you to hear really all about it. And I hope you're motivated. You learn a lot, just like I do on these calls, on what makes really your sleep better. CPAP is just a tool, but the end goal that we're all looking for today is how to improve your sleep and then improve your overall quality of life. So, without further ado, I'd like to introduce our speaker today, Dr. Audrey Wells. Dr. Audrey Wells is a board certified sleep medicine physician, a board certified obesity medicine physician, board certified in pediatrics, and also a very strong advocate of women's health. So today is your chance to learn. And then, yes, we do have time for Q&A at the end. We have 20 minutes or so saved for it. Please put your questions in the chat throughout the session. We will make sure we address them at the end. So with that, Dr. Wells, the floor is yours.
Thank you so much, Harika. And I want to welcome everybody to this webinar. I thought a lot about who might be attending this particular topic, and I think anybody who is on a sleep apnea treatment journey, whether that involves CPAP or not, you're thinking about it. Maybe you've run into some trouble. Maybe you're somebody that is kind of on the edge of what you think you can do. I want to share my screen here and first address CPAP attitude. So, this is how you show up to your therapy, which I think is really worth understanding because one of the funny things about using a new treatment at night when you're lying in bed and it's quiet and you're alone is that you're there with your thoughts and your opinions about your therapy are actually very powerful and have a big influence on whether or not you will be successful and how long that success will take. So when people finally get used to CPAP and they sort of look back on what that pivot was, oftentimes they can identify a fundamental shift in their CPAP attitude that allowed that transition to success. So I want to help you adhere to the adage, don't go to bed angry. Don't go to bed angry at your CPAP or, the fact that you have sleep apnea. I want to show you that it's entirely possible not to be reluctant or frustrated or annoyed. You actually have more control than you probably realize. And there are ways to avoid creating a mental burden that not only blocks your ability to sleep and use sleep apnea treatment, but just blocks that enjoyment of having natural breathing during sleep again. Now, coming up, I'm going to just give you a preview. There's a few slides that I have that are quite busy. So there's a lot of information on the slides. And I'm not going to go through them point by point. I'm just going to give you the opportunity to do a screenshot if you want. They're slides that I routinely review in other webinars, but for the purposes of this one, I'm just going to give you a chance to capture that shot. Okay, so for anybody who's diagnosed with sleep apnea, I want you to think back to when you were diagnosed and there was a treatment plan being put in place. And really, I think that's a really nice place of hope. Oftentimes, you're like, oh, this was why I don't feel good. I wake up all the time. I'm having problems with my heart, my diabetes, my pain. And there's this hope of getting healthy and deep sleep to finally start solving some of those issues. So in this picture, it's like your CPAP machine is the bike, and you just want to ride it to the finish line and get that healthy sleep back again. But for anybody who has struggled with CPAP, who has CPAP success that's been elusive, there's a certain reality, which is that things didn't go like you planned. And it's kind of like life, right? You have these problems with the mask, you have trouble with the pressure, and a lot of times You feel like you're kind of stuck in a river of misery and sinking down with a big hole in your boat. Things aren't getting better. But as an adult, I just want you to call on the fact that you have had life experience and that life experience can be applied here. You know, as an adult, that your mindset is like the lens through which you see the world. And it's a set of beliefs that shapes how you make sense of your circumstances and your identity and yourself. So your mindset influences how you think, feel, and behave in any given situation. And in the case of CPAP treatment, this mindset is going to directly impact your experience. So I've heard many people describe this love-hate relationship with CPAP, or you might just hate it altogether. And that hate or discomfort or resistance is not going to be consistent with getting good sleep. So it is to your advantage to do something about your mindset and the lens that you're looking at your CPAP through, because if you want a new result, you need to get a new mindset. So this is a great way to kind of set up the information in this webinar, because if you need help, we are here to help you. That is a very simple message, but I think it bears repeating. If you're here because you need help, we can help you. Let's level set, okay? Sleep apnea is oftentimes like just associated with the nighttime. It's the state of unconsciousness. You're not really exposed to all the effects because you are asleep, at least for part of the night. But I really want to drive it home that sleep apnea is a breathing disorder, okay? And it happens to occur during sleep, but it's still a breathing disorder, and a breathing disorder should get your attention. You wouldn't tolerate a breathing disorder during wakefulness, and the same is true for sleep. Now, the problem with sleep apnea, and this kind of gets down to the root cause problem that kind of ripples through your health, not only your physical health, but your mental health. The problem with sleep apnea is that it causes blood oxygen to drop when you have that obstructive airway. And because your brain does not tolerate an obstructed airway and low oxygen levels, your brain will wake from sleep, or at least go to a lighter stage of sleep in order to breathe again. Now, everybody knows drops in blood oxygen is not good, and interrupted sleep is not good. But I want to show you here how they overlap in their effects. Oxygen drops cause problems with your brain, your body, causes inflammation and stress. Same with interrupted sleep. So whether you're a person that tends to have big drops in their oxygen level, or you're a person that has interruption in sleep as your primary feature of sleep apnea, or both, what's going to happen is you will cause problems with your brain, your body, inflammation, and stress. So what does this lead to? Here is the first screenshot that you can take, okay? I'm not going to go through each organ system and how sleep apnea causes problems for that system, but I do want you to understand that when you're not fully treated with your breathing disorder of sleep apnea, it will directly affect your heart, your brain, your metabolism, your immune system, your weight gain, weight loss. It makes your body function as if it were older, okay? And if you leave your sleep apnea untreated or undertreated over time, it's going to put you at risk for accumulating multiple medical problems. Here's another busy slide, and I'd want you to just look at this when you have a few minutes and understand that because sleep is for the brain to rejuvenate, repair, flush out all the metabolites and everything, sleep apnea is going to affect your mind negatively. It will affect your cognition, the way you think, which is very important to how you feel. So it affects your emotions as well. And whatever we do in life, it's because of the way we feel or the way we think something will make us feel. So it affects your actions as well. And this really sums up to be a person's identity. So the way your mind operates is directly correlated to the way you see yourself and others, and sleep apnea interferes with that. So part of being successful with your sleep apnea treatment is being comfortable. Not just the physical comfort, but also comfortable from a mental and emotional standpoint as well. So you need to be comfortable with the pressure and the mask to hit that physical comfort, but emotional comfort because you know you're supported, you know you've got experts and a team on your case, and mental comfort because you know and understand what getting good sleep can do for your brain, your body, your mental health. Now, I want to give you some straight talk about the idea of a perfect mask. I hear this all the time from people who are struggling. They will really focus on the mask and say something like, I need to find the perfect mask. And they make it this focus of what's standing in between them and CPAP success. And I just want to tell you, you're not likely to land on the right mask for you on the first try. Some people do for sure. But I want you to actually expect that you're going to try several. And if you do end up with only one or two mask attempts, then it's just gravy, right? So loosen your idea on the grip of finding the perfect mask on the first try. It's one of those things that comes from being a beginner when you are starting something new, okay? Your mental health, your physical comfort, your emotional comfort, all of that is going to evolve as you are using a treatment like CPAP. So keep that in mind and be prepared to just let that process take place. Another thing I see a lot is people will say, I just can't get used to the pressure. And I put a picture of a balloon here because I find it useful sometimes to address the idea of pressure in a way that you can relate to better. Okay. So, one thing that I think is a myth is when you say CPAP forces my airway open, that word force is a little bit agitating because I don't want you to think that there's any force involved in this therapy. No one's forcing you to use it. That is your own personal choice. And the air pressure is not meant to be forced down. So the picture of the balloon is to create the idea that when you first blow up a latex balloon, you are using about 70 centimeters of water pressure to overcome that resistance and put air into that balloon. 70 centimeters water pressure. Most people on CPAP are going to be about in the 8 to 12 centimeters of water pressure range. So a whole order of magnitude less than what it would take you to blow up a balloon. So yes, your lungs can take it. Yes, that air pressure holding up the soft tissue airway and supporting normal breathing is gentle. You can absolutely get used to it, and hopefully that will shift your mindset a bit. But it is something that takes acclimation over time. And often we end up doing some fine tuning with pressure in the beginning before we work up to therapeutic levels. So, this is part of the reason why you need a team and follow up and expertise on your case. So, over the course of this presentation, I'm going to give you several tools. Here is tool number one. I want you to think of yourself as a CPAP mask strategist, okay? This means that you're going to have a scientific mind as you approach the evaluation of your mask, of your pressure, of your comfort. And you're going to do an assessment in your head and kind of capture the pain points on paper. Start with the mask. Put on the mask during the day. The reason is you don't have any pressure to sleep during the day. So that just adds a layer of suffering if you feel some performance anxiety when you're trying to sleep. So put on your mask during the day, adjust the straps, get them symmetric, get the fit right, and just practice for 15 minutes. Practice having the mask on your face. Observe with curiosity. You might put the pressure on. You might take some notes about how the pressure feels as you inhale, as you exhale. Write these things down to capture them because then you can take them to one of our respiratory therapists and describe the issue. And that's really important because we are very solution minded here. So we want to hear the issue and help you work through that. And even as you're collecting this information, which is going to be very personalized to your own experience, you can come up with your own ideas about how that challenge might be resolved. So, this is a partnership, truly. We are here to take in information about your experience and then create a solution both for you and with you so that you can have CPAP success. And truly, what, as Harika mentioned, what are we going for here? We're going for healthy sleep because the well slept version of you is the best version of you. And when you take care of yourself, you make a bigger and better impact on the world. Now, am all about humor. I love to joke around. I sometimes say I'm a lady of the night, ha ha ha, but not really. But I want to give you some tips about making a commitment to CPAP. You're going to need to draw on some grit. You're going to need your sense of humor. You're going to do some self-care activities to keep your sanity. As you're going through a CPAP acclimation get to the point where you're successful with your comfort, I really want you to realize that, as an adult, you've got a lot of experience with things going wrong in your life, but getting your sleep right is totally worth it. And hand at your back, everyone who showed up today to take control of your health. So, mindset is a key to success. Mindset is that story you tell yourself about your sleep apnea and your CPAP therapy. Mindset is malleable. You can change it deliberately, and oftentimes it comes in steps. So if you deliberately move from I can't do it to I want to do it, that is a huge step from the perspective of mindset, and all of this is available to you. And people who stick with it and keep communicating and keep modulating that narrative in their head, what happens is that they teach their brain that CPAP is safe, CPAP is for the breathing, and it's needed to have healthy sleep. Okay, I'm going to pivot now and start talking about tool number 2. But in the chat, I just want to hear, how many people, and you can just type me in the chat, how many people really think their CPAP attitude needs some reform? Just type me in the chat if that's true for you. All right, next topic. I want to talk about starting a new health habit. And this isn't something that's regularly taught from your health deliverers, your physicians and everybody else who supports healthcare. But I really want to help you understand that there's no instant gratification when you're starting a new health habit. And I'm a really visual person. So for tool number 2, I'm going to pull in some images here. And when something resonates with you, try taking a screenshot so that you can remind yourself of it later. So here I've recreated an image that I really like. And just notice that the difference between these two ladders shows the importance of small steps. And this is the truth when you're learning something new. So if you make the space between the steps too big, if you get too impatient, you won't get far, or you won't even be able to start. So you have to make a ladder for yourself with little bitty steps between the different rungs. And that means there are more steps, and it may take a little longer and require more intention, but it is worth it to reach your goal. And when you're making changes to improve your sleep, believe me, you are playing the long game. Sleep is a pillar of health, just like nutrition, just like exercise. These are realms which require playing the long game. Now, I've added another ladder here. This is an example of someone who is moving too fast. You just can't go from the mindset of I hate CPAP to okay, now I'm friends with my CPAP. And this is why positive thinking won't work. And sometimes people do automatically recognize that, so they put another step in there where CPAP is neutral. But really, even that doesn't help a great deal if you're a long way from where you want to go. And I'm talking to anybody now who has been like white knuckling it, trying to get used to their CPAP machine. So just dial that back with that expectation and realize that if you can identify some smaller steps to make progress forward, you're doing great. And when, not if, but when you have a setback, knowing that you had some success with the smaller steps can help you get up and recover quickly because you've kind of gained that experience, right? That's okay. Now you've got some learning under your belt. And you're going to have a lot of thoughts and a lot of feelings along your CPAP journey, and that is okay. It's very normal because when you're sleeping, it's a vulnerable place. And so when you add an apparatus to help you breathe on top of your sleep, of course you're going to have some thoughts and feelings stirred up. But if you want to get friends with your CPAP as fast as possible, I have another tool for you, which is I really want you to commit. I want you to commit to CPAP and learn to pace yourself. What that looks like is a 90-day minimum where you're just saying, this is the time I'm going to give myself to acclimate to PAP therapy. Now, this is not hard and fast. And certainly if you're somebody who feels like this is too much for you, dial it back. But really identify a time where you can acquire a new health habit in a reasonable way. I would set the minimum at 30 days, okay? But better 90 days because any habit for your health is going to take about that long to implement. And in terms of acclimating, it's going to be days to weeks, more commonly weeks. So we really have a high touch program with respiratory therapists or RTs who are doing a lot of contacts in those first few days and weeks to help people feel supported, do some active troubleshooting, encourage you to practice regularly, and encourage you to be consistent. If you want to feel better, that consistency, that nightly use is going to be key. And recognize that you are not a machine. You're a human being. You're trying to do your best, and I see that. And your best is going to look different every day. And that's totally fine. Because part of the reality is that you're going to have some ups and downs, sometimes one step forward and two steps back. But because those steps are smaller and more deliberate, you're going to be on a path to success. Now, I'm a gardener, so this is an analogy I like to use. Starting a new habit is like planting a little seed in the ground. And then every day you water that seed, and you're not going to see results for quite a while, even though you're doing the work to care for it. But you kind of have faith, right? That the seed is busy and changing below the surface. You can't see that, but you do trust that it's growing, and you don't dig it up to check every few days. Because once that root is established, it's going to start sending up a fragile little shoot above the surface. And that's a little win, okay? That's some reassurance that you're doing the right thing with this daily care. And you keep at it day after day, and you nurture that little seedling. Sometimes people ask me, how long do I have to wait until I see results? And it's a little bit tricky to answer because it's a personalized kind of question. But what I can tell you with 100% confidence is that just showing up consistently, sometimes messy, sometimes not messy, sometimes ideal, sometimes not, but showing up consistently every night to use your therapy is going to get you to the habit that you want quicker. Because sleep is a skill. And it's way more important to do the habit every day than to be perfect at it. So another analogy is like if you're learning to lay bricks and you put one down every day and put the mud on and try to line things up. Well, when you first start out, your bricks are not going to look great. But the truth is, you get good at what you practice. So every day you have a chance to lay down another brick and practice more, and they're going to be wonky for a week or two, and that's okay. But you keep practicing and you get good at whatever you practice. And this is true for anything. So it's kind of like a life lesson. And you have a lot of control over how long it takes to get comfortable with CPAP. You just have to show up and do it every day. Even if it's imperfect, uh, just be regular with it. I really like this quote from James Clear. Every action you take is the vote for the type of person you wish to become. And, just getting back to the pillars of health, this is true for every meal that you eat, every rep that you do in the gym, every night that you have of sleep. These habits accumulate like votes, and they lead to the person that you want to be. It's no single act. It's the accumulation of all of these votes that transform you. So tool number 2 is pace yourself. Remember, you're going to take small steps, you're going to show up consistently, and you're going to take the mindset of developing this sleep skill, because if you practice, you will get good at what you practice. Now, I want to give you a resource here. I host a free Q&A session every Thursday at noon Eastern Time. It's a webinar format, but you can actually come on and talk to me. You can tell me your situation. I can certainly give you ideas about what has worked for other patients. This is a situation where I kind of show up. I'm not your doctor, but I can bring all of my medical expertise. And it's nice too, because you are in a safe space among other people who are using PAP therapy. I also bring our fabulous respiratory therapists on the call. So the RT team is there. You can see Alyssa and Carissa and ask questions to them. They weigh in with all of their experience too. And I usually do a little bit of teaching, anything from how to address nasal breathing to air leak to weight loss to CPAP alternatives, all the things. So it's an open session. It's 30 minutes long. It's free. We do this weekly, and I'd really love to see you there. Okay, now I'm going to go into the next part, which is the idea that healthy sleep means taking care of the future you. So sleep affects your day-to-day life, but it also affects your long-term health. And using CPAP means that you have to think ahead a little bit because there's some maintenance to it. Now, hold on to your seats because I'm going to get a little gooey with you next. We're going to talk about the organic body. So we are very interesting beings in that we're an organism. Anything that touches the human body is going to accumulate sweat, oil, dead skin cells, particulate matter from our body. We are constantly shedding and lubricating and sweating and all of that. So this is why after a time we throw out our old t-shirts and we wash our bed sheets and we don't keep underwear forever. So when you're using CPAP, you really want to take care of your hygiene, and you want to recognize that there are supplies that go through wear and tear and they don't work as well as they did in the past. So although sleep hygiene is a thing, that's not what I'm talking about. I'm talking about CPAP hygiene. That means keeping your supplies clean. That means at least doing a wipe down of your mask daily. That means a weekly cleaning routine that's going to take a few minutes. And that means thinking ahead about changing supplies. And it's kind of like, we clean our teeth, right? We take care of our dental health by doing the daily brushing, and we see the dentist periodically, and we change out our toothbrush every now and again, and especially after you've been ill. So the idea is similar. We need to refresh supplies. Now, With Sliiip.com, I have a fast, cheap, and easy CPAP cleaning guide. This is a resource that we give all of our patients. I'm just going to run through some of the principles here. So, for example, the daily cleaning should only take a couple of minutes, truly. This means you're going to remove and empty the water chamber. That water should not stagnate in there. Allow it to dry, just air dry completely. Then you're going to wipe your mask, the cushion, the part that touches your face, with a baby wipe, or you can use a little baby shampoo to wash it. And then you're going to shake out any water that's accumulated in your CPAP tube. And just as a pro tip, a lot of people benefit by switching out tubes because they have two tubes. So they have one that's drying and one that's being used. And the next day they switch those out. So having two tubes can be a little pro tip. On a weekly basis, you're looking at 10 minutes of maintenance, okay? So this means you're making a bath for your CPAP parts. You're going to fill up a sink, sometimes a plastic tub, add some water, some unscented dish detergent or baby shampoo. And you're going to take your parts apart and put it in the bath and give it a swish. So you're going to soak it, take it out, everything's ready to dry. And this is because of the sweat, the particulate matter, the oils that are accumulating. You need to get rid of that stuff because it's hygienic and because you want your equipment to work well. So many people ask me about ozone cleaners and UV light cleaners, and I'm here to tell you that if you use these, it means you've spent a pretty penny. And I'm sorry to say that it's not doing that much. It also may avoid or void your PAP device's warranty. So if your CPAP machine is less than 2 years old, whether it's Respironics or React or ResMed, the manufacturers are clear that they will void the warranty. Now, why don't these cleaners work? Well, the problem is the CPAP parts that touch you, especially the mask, they pick up dead skin cells, they pick up oils and particulate matter that these cleaners do not get at. So they may sort of sanitize from an arm's length away, but the particulate matter is not resolved. So really, this is not something I recommend. If you are using one of those, just realize that you need to also have that washing in order to get rid of the particulate matter. Now, about once every couple of weeks, sometimes a few weeks, you want to check your filters, the disposable filters that are in the machine, replace it if it's dirty. There's some personalization here. And I put a picture of a dog and a cat here because I love animal lovers, and I am one. But if you have a lot of dust or dander, pets in your home, your filter schedule should be on the shorter end, so like every 2 weeks, compared to someone who does not live in a dusty area and does not have pets. Recognize too that CPAP supplies are meant to be replaced. So what do I mean by supplies? I mean the cushion of the mask and eventually, the frame and the headgear, the tubing, the filters, and like less common, the humidifier chamber. So these are called consumable supplies. They're meant to be replaced. How do we know this? Well, there's actually a Harvard Medical School study where they took someone who was using CPAP regularly, nightly. The person was very deliberate about their cleaning, had a really excellent regimen. And the question was, could cleaning alone be sufficient, or do you actually have to replace the equipment to get it fully clean? Well, this is the result. They put a mask that had been completely cleaned. It was about 6 months old, well taken care of, and they were still finding bacterial components after the cleaning. So this is before the cleaning, this is after the cleaning, again, before the cleaning and after the cleaning. There is still bacterial colonies despite the cleaning. And why is that? It's because these parts develop micro cracks and crannies, just places where bacteria and fungus can hide out, even if you're having a good cleaning routine. So again, parts are meant to be replaced in order to avoid bacteria buildup. All of us have bacteria on our skin, in our nose, in our mouth. You replace your parts to avoid discomfort. You replace your parts to avoid skin irritation, illness, infection, leak. And ultimately, you replace your parts so that you're not having ineffective therapy for a number of weeks or months. Okay, let's do another yuck factor here. This is the Demodex mite. This lives in everybody's pores. And if you don't replace your mask, this is problematic because the Demodex tends to get out of control with their population. These little mites feed on skin oils and debris, both on your face and in the nooks and crannies that accumulate in unwashed masks and cushions. So you can actually get skin irritation, and this is a rather extreme example with the cartoon on the right, but you can get skin irritation if your supplies are not replaced regularly. So here is a replacement schedule. You can find this as part of our initiation. There's also a checklist, doing a tracker to replace what you want. We have all of this available as part of our support. And tool number 3 is you can also just press the easy button, okay? So you don't have to keep track of all of that stuff. You can actually join our resupply program at Sliiip.com because you know your supplies are going to wear out, but you don't want your sleep to be compromised as a result. So what the resupply program does is it puts your supplies on a refreshment schedule every 3 months. And this means you avoid air leaks, you avoid skin irritation, you avoid discomfort, you avoid frustration, you avoid the bacteria and the mite infestation, and you avoid the slow decline in PAP effectiveness because you know your supplies are not creating vulnerabilities there. Because for goodness sake, if you're going to go to the trouble of using CPAP to treat your sleep apnea, let's do it right. Let's get things changed out as they should be. And I kind of laugh because I saw this on Instagram recently. Somebody was joking that CPAP is like microdosing on life support every night. And, I think that that resonates with me because sleep is that important, seriously. Like it's a breathing disorder. You need that fixed so that you can go on to having all of the benefits of normal breathing during sleep. So it is inherently valuable to treat your sleep apnea so that you can enjoy all of the things that healthy sleep can do. And I want to point out too that if your road to this point has been quite rocky, it's no problem, truly, because there's a lot of things that are reversible. So don't feel like it's too late. There's things that can be reversed. You can actually enjoy healthy sleep. Okay, so I want to review the tools here. First one is you're a CPAP mask strategist, you're a CPAP pressure strategist. Define the issue, the pain point you're having. Take some notes and look for ways that you can modify your CPAP attitude and expectations. Also, pace yourself. Again, sleep is a pillar of health. It's on the same scale as exercising to get physically conditioned and eating well to improve your metabolism. This is not something that's going to happen overnight, and you need patience, you need humor, you need grit, and you need support as you're going through this. What can you set on autopilot? So get your cleaning kit set up, get your supplies automatically delivered. You want to press that easy button so that you are on a schedule and you don't have that mental load of having to remember all of these things and doing the checklist. It's a burden, and problematically, it can lead to your sleep eroding before you remember that your supplies need a refresh. Now, for Sliiip.com patients, we actually have a CPAP hub available to you. This is a new thing that we're doing for our patients, and it's a gateway to a ton of free resources. The resources include videos for troubleshooting. They include frequently asked questions. You can get an appointment with your sleep specialist, or you can get an appointment with a respiratory therapist to go over your issue. And all of this, because it's a website, is available 24/7. It's available at bedtime, it's available in the middle of the night. So you can get in there and see what applies to you, what help you can get. Finally, I want to point out that the whole team at Sliiip.com is a resource. For those who don't know, this is a physician-founded company. It's a physician-led company. That means we're interested in your health. We have sleep specialists, both MDs and nurse practitioners, that are specially trained. They're highly experienced and they're available. They give you that access to care that a lot of other sleep centers don't because it's not a one and done episodic thing. You're going to need some support. You're going to need personalized options. We have a respiratory therapy team or RT team for PAP support. They are really involved in monitoring your benefit with CPAP. They do adjustments for comfort and fine tuning the pressure. We do this remote patient monitoring program where we can see, is your machine leaking? When is it leaking? What is your report on your airway obstructions? How is your usage? All of these things go into a high touch experience that is especially there for you in the first 90 days, or if you need it after being away from CPAP for a while, you can come back and have that experience again. And then finally, there is support and community through free educational webinars like the one you're seeing now. And I do free weekly Q&A sessions. That's what I mentioned on Thursdays at noon ET. That would be 9 a.m. Pacific, 10 Mountain, 11 Central Time. This is a safe space where you show up and be among others who are diagnosed with sleep apnea, who are on this journey to figure out how they're going to get treated. So everything on the slide here is available to you. I hope this has been a helpful reminder of what tools you can apply if you're interested in CPAP success. And it's really not, it's not to make the insurance company happy. It's not to do anything other than protect your day-to-day well-being and your long-term health. And sleep is really that powerful. All right, I'm going to stop sharing now. I want to point out that there is a Q&A. You can put that in the chat. We're at about 17 until the top of the hour. And I have a few questions in here. I'm going to give people a chance to ask a few more. I'm going to transition to telling you a little bit about our company, which I mentioned, but I want to get a screen share up here, and there we go. Okay, so Sliiip.com is a telehealth company. We are available in all 50 states. So whatever state you're in, we can see you. We actually do see patients from Canada and overseas sometimes, but we do have a strong presence in all 50 states. We have a fantastic patient rating because we really strive to do our best with patient care. And we work closely with referring providers, such as your cardiologist, your neurologist, your pulmonologist, your primary care doc. We work closely with everybody to try to elevate the sleep conversation, but also we don't stop working until your sleep issues are resolved. We do have more than 40,000 consultations. We have more than 1,000 partner clinics. And as I mentioned before, we have an expert team available who does the appointments and follow-up. All right. Here is an example of one of the home sleep tests that we use. And I point this out just because it's small, it's not invasive. We do as much as we can when you're in the comfort of your own home. So not only are our appointments virtual, but our home sleep testing is virtual as well. And we can do multi-night testing, which is important for somebody, especially if the first night capture doesn't feel super representative of your normal situation. Whether you're a person who wants a sleep evaluation or wants another set of eyes on your sleep care, so if you're a patient or a referring provider, going to Sliiip.com is going to allow you to do a self-referral or if you're a clinician, place a referral for one of your patients. There's a referral button at the top. You can also access our schedule, our clinical schedule as a patient to get onto the clinic appointment times. And there's a really short form to fill out, just giving us some contact information. This is especially important for referring providers because I'm very interested in closing that loop of communication. I see it as a collaboration with the patient that we're sharing in common. All right, and with that, I'm going to stop sharing again, and I'm going to go to the Q&A. We've got about 14 minutes here, and so I'd invite people to just enter their questions in. And yeah, we've got questions in the Q&A and questions in chat. I'm going to take a little bio break here because I've been dealing with a cold. And for anyone who signed up 2 weeks ago, thank you for your patience because I was very sick and I did not have a voice. I'm still fighting that off. So let me put on mute for a second. All right. Very human, all of us here. Here is the first question. How do you get on the monthly program to have the right parts come every month? I don't see that on sleep.com. All right, so the answer to this is you do need to be a patient of ours at sleep.com. The resupply service is available to people who are in our ecosystem. And when you become a patient, then the respiratory therapy team will approach you about getting on the resupply program to just press the easy button and they'll sign you up and take care of everything. The program is modifiable. We can customize it to some degree. And really, I find that this heads off problems at the pass because a lot of times when people have issues with leak or gosh, it doesn't feel like it's working anymore for me. How old is your mask? Well, it's like 8 months old. Ugh. Okay, that's the first thing to do is replace the mask. So that resupply program is really critical because it means that when you show up and you're like, I don't feel like this is working for me anymore, and I've been changing out my supplies, we can do a very directed dive into helping you. What happens if I do not fill the water tank enough and it runs dry? Will it be hurtful? Actually, no. And some people don't put water in their tank, and you can actually turn off the plate that heats up. Let me say a few words about this because I think it's a common question. The water in the humidifier chamber is heated up so that water vapor develops at the surface, and the air blows over that surface and picks up the water vapor and brings it to your mask. That's directing the air pressure into your nose, preferably, or into your nose and mouth. And what that's doing is helping to increase comfort because it's always nicer to breathe air that's humidified. But in some areas of the country, of the world, you're going to get that ambient humidification. So some people don't use the humidifier chamber, and you want to click off your the heating plate with that. If you run out of water in the tank, you know, there may be instances where you're waking up feeling dry because that water has been used up, but it's not typically hurtful. Certainly, you can fill your water tank up a little more, up to the top of the fill line. Or for some people who are on higher pressures, putting more water in the middle of the night is an option. Where are the replacement charts and schedules on the website? We don't have them on the website yet, Linda, but they are available with the RT team. That's one of the things that they dispense, especially as they're setting up patients with CPAP therapy or at patient request. All right, so let's jump over to the chat here. Okay. And I'm scrolling. All right. I've been on CPAP for a few years, continue to struggle, but have gotten more used to it. Headaches have started over the past few months. All right. So to address this question, I just want to zoom out because timing is always going to be a factor with your sleep apnea status. Okay, so when you say, I've been on a CPAP for a few years, I am guessing that your sleep test was most recently done a few years ago. And I want to point out that sleep apnea changes over time. In fact, age is the primary driver for changes in your sleep apnea severity. So, developing headaches over the past few months may be related to outgrowing your pressure setting. It could be related to the way your mask fits on your face or the way the headgear is placed. It could be related to, some sleep deprivation, which could be due to CPAP or not. So, headaches is a very broad symptom. It's one of those non-specific symptoms. And Mary, I would want you to have like expert eyes and get a conversation with a sleep specialist going about what could be factoring into this change in your status over the past few months. But to suffice to say, sleep could definitely be a factor. That's a very common relationship with poor sleep. Gives headaches. Ask me how I know. Okay. I used oral appliances, many variations for decades. I've been using CPAP for about 8 weeks instead now. So that's great, Mike. And I will tell you that I have a number of patients who do a combination of the two. So, like oral appliance therapy when they travel and CPAP when they're at home. Some patients do both simultaneously, meaning the oral appliance, which is custom made for a person's teeth, brings the jaw forward to open up the airway caliber. And for people who are using high CPAP pressures, that oral appliance can lower the pressure requirement and in some cases get rid of the pressure requirement so that they don't need as much air pressure. How to access the weekly webinar. You're going to go on Sliiip.com. There is a resources tab. And there's a link to the Q&A. I'm thinking you're meaning the Thursday Q&A session. I also do educational webinars like these at least once a month, sometimes twice a month. Sometimes I bring on a guest for a type of patient symptom that seems really relevant. So we are big on education. We're big on credible education. Like we're not TikTok people, but we do have expertise. And I would certainly invite you to show up for all the free education you can get. All right. Instructed to soak tubes in vinegar water mixture. Yes. Dilute vinegar water is a good way to clean your tubing. You can use baby shampoo. You can use Dawn dish soap as well. It's really a personal preference. All right, the Thursday session link is posted in the webinar chat right here, so you can have access to that. And just kind of bookmark it if you'd like, but it will let you sign up for multiple sessions. All right, I learned to help others. I'm a pediatric dentist. Sleep issues starts in childhood. Absolutely. And we work closely with dental colleagues to really accentuate people's access to care and their treatment options. Now, where kids are concerned, there's a big movement now toward preventing sleep apnea in the first place. And often that's related to a high arched palate, teeth crowding. If you can make that palate more broad so that you have good tongue posture, it helps with nasal breathing. And it's such a good preventative tool. All right, ResMed analysis software has these results. Can they be addressed? There's a lot of information here. Let me see if I can. Yeah, I'm not sure I can take all of this in the few minutes we have for questions. What I can tell you is that this is a personal situation and really good to bring to a sleep specialist who will not only be able to read what the result was, but to also look at visual data that comes with these machines. Web address is sliip.com. That's SLIIP, because we've got all our eyes on your sleep. Resupply program is not on the website. The resupply program is within the CPAP hub, which is for patients of Sliiip.com. That's part of the high touch experience that we're giving. All right, any advice about sinus headaches from longer term CPAP use? Yes, lubrication is your friend. This is actually something that I went over in the Q&A webinar yesterday. So Thursday at noon, we had a very lovely group, and one of the questions was about mouth dryness, nasal dryness that can lead to sinus inflammation and headaches. When you are applying air pressure and fully treating your sleep apnea, your risk for sinus problems does go down, especially if that humidification is where it needs to be and your sleep apnea is fully treated. If your sleep apnea is not treated well, if it's a bit undertreated or you're only using PAP therapy for a portion of the night, then you are going to be vulnerable to inflammation in the nose, which can lead to sinus headaches because that inflammation causes the opening of the sinus to swell and close down, and the tissue is going to be inflamed. And that results in bacteria accumulating literally within the sinus. The recording of the webinar will be available. We send that out in an email. We always have live people here. I love the questions. And I think, it's really impactful when you show up for your own health live. I love my CPAP, and you are such a good example for others who are having a different experience because you can get there. I don't clean it ever and replace parts only rarely. My question is, if I get the 3-month replacement and use my cleaning every day, think that could be good. Sleep is great, but I get every sickness that passes through my neighborhood. Yeah, I would at least recommend changing your CPAP mask supplies at this point. The silicone mask cushion does decay, become more stiff. And, unfortunately, that's associated with quite a bit of leak. Sometimes people are aware of that, sometimes not. And everybody's going to have a little bit of difference in the amount of oils they produce from their skin, the amount of shedding from their skin. It's really a spectrum. So can some people go longer than 3 months? Yes, they absolutely can. Some people can go longer. But just, for safety, kind of a belt and suspenders approach, it's like the oil in your car, right? You don't really want to wait for your car to get a problem before replacing your oil. You want to change your oil on a schedule so that you can avoid problems. So yeah, I would recommend replacing your stuff. 3 months in, I still can't get a proper fitting mask. Awesome, come see us because we can help you. We have some tech that we use. We also have a lot of experience in pairing people with certain masks. Is it critical to empty the water chamber every day and put in fresh water? No, I would not say it's critical, but here's what you want to look out for. If you're seeing a pink tinge or like kind of the water looks sludgy as you're moving it around, es no bueno, okay? You need to empty that out and you want to do it before it gets to that point. The pink tinge is a bacteria called Serratia, and it's no good for your respiratory system. What does a person when they travel often for work? So there's travel CPAPs, there's which are very small, like the size of 2 Post-it notes. Your CPAP mask and machine comes with a carrying case. Once you bring it on a flight, you will see many other people with CPAPs. It's so common these days. Dr. Barr and I have been talking, but continues. Keep talking to Dr. Barr. He's an expert. When I started CPAP therapy, I looked at this as a marriage. Lots of ups and downs. 3 masks later, and the pressure changes have finally found the sweet spot. I think this is perfect. You have a relationship with your sleep. You have a relationship with your CPAP machine. You're not going to expect perfection. There are some ups and downs. Are there cost figures for membership in Sliiip on your website? Is there an initial concierge practice charge? So we have self-pay options. We also take insurance and we go through insurance whenever possible. A lot of people have a deductible. I want to tell you that starting your sleep evaluation now, oftentimes you will meet your deductible and then your care is covered after that point. So keep that in mind because, again, sleep has a value that you really can't connect a dollar figure to. It's like it affects your life, right? Your day-to-day life and your long-term life. All right, guys, I am going to sign off. We're at the top of the hour. I think we answered all the questions. And I want to say, really, the point of this whole discussion was to make it clear what resources are available to you. So keep striving toward CPAP success. All right, I hope to see you guys in the live Q&A and on future webinars. In the meantime, I'm Dr. Wells. I'm the Chief Medical Officer of Sliiip.com. If you need help, we can help you.